An Olympic achievement, getting COVID-19 vaccines to the disability community. This past summer, many Minnesotans were able to celebrate the return of music and food festivals, neighborhood nights, and for some people, the Special Olympics, which had stopped the last few years because of COVID-19. This summer, the Special Olympics Minnesota hosted a weekend of competition with over 2,200 athletes, coaches, and partners in Stillwater, Minnesota. Minnesota Department of Health partnered with the Minnesota Disability Law Center and the Stair Step Foundation, one of MDH's COVID community coordinator organizations, and they were able to vaccinate 41 people with either a primary series of the vaccine or a booster at the Special Olympics Minnesota. This past summer, many Minnesotans were able to celebrate the return of music, food festivals, neighborhood nights, and for some, the Special Olympics of Minnesota, which stopped for a few years because of COVID. Special Olympics provides Olympic-style sports training competition for children and adults with intellectual disabilities. Since 1973, the Special Olympics-style sports training competition for children and adults has created a space for people in the community to build their physical fitness and partake in other competitive sports with other athletes. This summer, Special Olympics Minnesota hosted a weekend of competition for over 2,200 athletes, coaches, and partners in Stillwater, Minnesota. One part of the Special Olympics program is called Healthy Athletes, which provides free health screenings and education to Special Olympics athletes. As their website shares, despite a mistaken belief that people with intellectual disabilities receive the same or better health care than others, they typically receive substandard care or virtually no health care at all. For this summer's Special Olympics, the focus was not on just the sports competition, but also for inclusive health. The Minnesota Department of Health, MDH's Health Promotion and Chronic Disease Unit, initially fostered ties with Special Olympics Minnesota through the division's work to adapt the National Diabetes Prevention Program for people with mobility disabilities. The division also supported their work related to capacity building among public health staff, Cody Olson. MDH's new Disability Systems Planner, Cody, rekindled MDH's involvement in the program following the COVID-19 pandemic. He, along with Rachel Garrity, who is MDH's disability lead for the COVID-19 Community Coordinator Initiative, championed the idea of bringing an MDH presence to the Special Olympics. Events that bring the disability community together have been rare since COVID-19. Garrity said, more than 1,000 people from the community attend the Special Olympics in Minnesota per day. So this was such a special opportunity and a great success to have community gathering of this size and follow and allow MDH to support and build their presence within the community. Garrity noted that many people from the community have felt isolated since the start of the pandemic, and early public health recommendations did not always take the needs of people with disabilities into account, which created situations where their well-being was negatively impacted. As a result, many lost access to resources. Prior to COVID-19, MDH had a more limited system for engaging with the disability community. The MDH Disability Unit was created to help address these concerns in the community and help address needed services and resources. MDH now engages more directly with the community and continues building new relationships. For both MDH and community partners, opportunities to connect and collaborate to help advance health equity in Minnesota. J.P. Mahoney, another member of MDH's disability team, also credits the work of previous MDH disability unit members, Lisa Gemlow and Ann Schultz. They really paved the way to more collaborative and direct community engagement with organizations that provide advocacy, public policy, and services and supports for people with disabilities. Mahoney reflected that there has been a shift in the way that work had been conducted, and he is excited about the current mindset of making sure that everyone has an opportunity to be as healthy as they can be. Going for a gold medal in community partnership. The disability team reached out to Jeff Prendergast, health programs coordinator for the Special Olympics, to inquire about the possibility of collaborating, and the idea was met with great enthusiasm. Special Olympics provided MDH with an outdoor space in their new main event area. And MDH also partnered with the Minnesota Disability Law Center and Stair Step Foundation. And one of MDH's COVID community coordinator organizations, and they were able to vaccinate 41 people with either a primary series dose of the vaccine or with a booster. MDH also offered free COVID-19 tests and masks to anyone who was interested. Even for the people that chose not to get vaccinated during the event, Garrity noted, it was still a really positive experience for many folks in the community having their first interaction here with MDH. Garrity says that she can never stress enough the importance of working with community partners like Special Olympics Minnesota. She says they are already trusted by the communities that they serve. And so when MDH works with them, it allows us to support those communities and validates our work and trustworthiness. MDH partners know the disability community better than anyone else. And MDH continually learns from the knowledge, advocacy, and advice that the community partners will bring in. The team firmly believes that strong relationships with community partners help MDH shape the work that the team does so that they're meeting the needs of their community, and the team knows when those needs aren't being met and can actively work on the issues. Challenges and barriers. While working with Special Olympics was a phenomenal and positive experience, Garrity, Olson, and Mahoney continue to elevate and address barriers and challenges that the disability community faces. One of them is the negative impact that COVID-19 has had on the disability community. People with disabilities have higher rates of hospitalization, severe illness, and mortality from COVID-19 due to inequities in accessing vaccination, treatment, and testing. Garrity noted that they have experienced higher levels of social isolation, a severe shortage of caregivers for people with disabilities, and ongoing discrimination by many medical systems. MDH is actively working to address these inequities. Garrity says the MDH disability team is committed to being aware of those barriers and doing everything that they can with partners and on their own to overcome them. One action item that Mahoney reflected on is continuing to prepare and notify the community about opportunities like MDH's vaccination clinic at Special Olympics. During the vaccination event, Mahoney noticed that most people getting vaccinated were supporters of people with disabilities. such as parents or caregivers, and not the people with disabilities themselves. He hopes that with increased flexibility, preparation, and investment in the community, MDH can create environments that combat ableism and foster a culture where people with disabilities are directly engaged and where they can feel confident making their own public health decisions. The games and the public health initiatives continue. Despite the fact that the summer game events are over, the work continues. Garrity says she's excited that for the next 2 years, until June of 2024, MDH will have 6 dedicated COVID community coordinators that serve the disability community, 2 of which will be focused on providing vaccination-tailored events for the community. She said having 2 specific COVID community coordinators in the disability world out here hosting vaccination events will help lead to additional partnerships and relationship building. Part of this work will mean continuing MDH's partnership with Special Olympics. And in fact, the work has already begun to plan flu and COVID-19 clinics for the community this fall. As parting words, the disability team shared that everything we do is part of our commitment to work with the people with disabilities in our community and organizations that support people with disabilities. The team hopes to continue broadening and strengthening partner relationships over the coming years and expand their collaborative approach to address the health inequities for people with disabilities throughout the scope of public health.